So let's move on to our program and this important topic, the mental health crisis in Santa Cruz County. We've all seen the headlines and stories about the increase in depression, suicide among young people, and just ongoing mental health challenges throughout the country, and our small little county is not exempt. Today, we're going to hear from people who have firsthand experience facing these challenges. Today, we have Dr. Farah Sabah, Superintendent of Schools, Chris Clark, Chief Deputy with the Santa Cruz County Sheriff's Department, and Karen Hearn, who is with the Behavioral Unit. So let me tell you a little bit more about each of them, and then our panelists are going to come up. And we will have questions at the end from both folks here and on Zoom. So Dr. Sabah was elected as superintendent in 2018. And before that, he had many different positions as an instructional aide and teacher, and he transitioned into leader positions, and he's been with our county for 30 years. No, he has 30 years experience. Yeah. Dr. Sabah immigrated to the Bay Area with his family to escape the Iran-Iraq War. He soon relocated to his mother's native country of Ecuador and returned to the U.S. to attend UCSD. And then he went to San Jose State, where he has a doctorate in leadership for educational equity from UC Berkeley. And Chris Clark is currently the chief deputy in charge of our Law Enforcement Bureau and leads the Patrol Community Policing and Investigations Division. He's been with the Sheriff's Office since 2006 and has held about just every position in the office, including a pilot on air unit. He has a bachelor's degree in criminal justice from California State University, Sacramento, yay, and a master's degree in emergency services administration from California State University, Long Beach. And Karen, who's recently located, she's only been here in our county about 2 years, I think. She has over 20 years of experience in the behavioral field, working with adults and children, both in California and Oregon, providing clinical and operational oversight to a diverse array of programs and services. Karen holds a BA in Social Services from Washington State University, a master's in Public Administration from the University of Nebraska. She serves as the Adult Services Unit Director for the County of Santa Cruz Health Service Agency's Behavioral Health Division. Well, that must just barely fit on your card. So we're going to have our panelists come up to here. I'll move the speaker over. And while they get settled, here are the questions and issues and topics we'd like them to touch on. How do each of you assess the state of mental health issues in our community? What kind of problems are we facing? What additional resources does your agency or department need to adequately respond to the mental health crises and issues that we're confronting? What are potential additional sources of funding? And how can the public help you in your efforts to address the mental health issues in Santa Cruz County? So this is a delicate thing where we move one speaker over. Where does it go, Mike? Right in the middle? Okay. So why don't we start with Dr. Sabah and then, so just in general, you don't have to go through each of those questions, but
Great.
Happy to review. Thank you.
Thank you. Right.
Thank you. Good morning. Thank you for the opportunity to be here to speak with you. So we in the school system really have been experiencing a significant and extremely concerning increase in mental health challenges for our youth. We conduct a California Healthy Kids survey every 2 years. And in that, we ask students questions, it's anonymous, and we ask them questions about how they're experiencing school, how they're experiencing, are they feeling depressed, are they feeling, have they seriously considered suicide, a variety of, it's really hundreds of questions that are asked, and this is done countywide. And the numbers are always of concern when we see students who've identified themselves as having considered suicide in the last 12 months. But what happened between 2019 and 2021 was a huge increase in the students that were identifying that they were experiencing anxiety, depression, suicidal ideation. And schools, there has been a transformation that's, I think, a real positive thing, where schools are becoming more like community centers and being able to offer a wide range of support services beyond education, including mental health services. And what we're seeing at school sites is an increase in behavioral issues for students, disruptive behaviors, big behaviors, students acting out, acts of very aggressive behaviors. Students are communicating to us in a variety of ways that they're experiencing, that they're really having a tough time. And when we look at the data, this is exacerbated and increased for certain groups of students. Our LGBTQ students, for example, 40% of our LGBTQ students have shared that they have seriously considered suicide in the last 12 months, for example, compared to 12% of the general population or their non-LGBTQ peers. And so we feel that we are in a crisis, and it's not always a visible crisis. There are some visible aspects to this, but there is a lot of quiet suffering that's taking place. And we will be talking, I guess, a little bit later about the kinds of things we're trying to do to support our youth. But we recognize that from a variety of different sources that we are in a mental health crisis for our youth. So I'll stop there and pass it on to my colleagues here.
Hi, again, thank you for having us here today. It's an honor to be here. Just to echo on the youth and suicide, we're also seeing an uptick in suicide ideation expressed in adults. And I think that coming out of our isolation, self-isolating time in COVID, we're finding that people have really been disconnected from community and supports that they had prior to that. And so we're thinking that is contributing a lot to it. I think also in our behavioral health services, so at the county, we work with people when they're really at their lowest point, and they come in to us for help. We get referrals from all over. We also contract with many agencies out in the community, Family Services Agency. Andrea Taleo's back there, and she is supporting our suicide prevention planning with our 988 line. So I just think, you know, we have a lot of services, and what we're seeing in those services is an increase of people coming in crisis and fewer resources in some ways to be able to meet the need. So I think when we think about the community focus of services that we have and getting people really back into the community, coming out of COVID, making those connections, ensuring that they are building those relationships that support and promote resiliency, those are going to be key to us to solve some of the problems that we're seeing right now.
Well, good morning, and thanks for having me. Yeah, definitely an uptick in the intersection between law enforcement and folks in crisis. I mean, we've seen this kind of increase over a period of time. With our calls for service, folks in crisis and responding to people in crisis amounts for about 20% of all of our calls for service, 75-ish thousand calls for service. About 3,600 are responding to folks in crisis. We write between us and our mental health liaisons about 20 to 25 5150 holds per month. So these crisis calls amount to about 300 a month. So about 10 every day our deputies are going to in a very challenging issue. And COVID has exacerbated it. And you know, we've seen this, and so, but we're developing and have developed a pretty good response to this. I mean, this is something we saw kind of change in national sort of dialogue with regards to the intersection between people in crisis and law enforcement, and wanting to make sure that we're kind of exhibiting that compassion and making sure that we're bringing the right people, the right tools to those situations. So we have mental health liaisons that Karen's group has given us. We have two that basically have 7-day-a-week coverage. They go with us to these calls and are a huge resource. I mean, I can't tell you, I've seen literally almost miracles happen with our mental health liaisons, from talking people off of the ledge of a bridge that I thought this person was going to jump to their death, to I could name hundreds of calls where they're just such a huge resource. And this is where the dialogue is being done by a mental health liaison, where we're there literally just as an added layer of protection, so that the mental health liaison doesn't have to worry about their own safety, which is a huge, they've said that that's a big benefit to them, to allow them to be able to, conduct therapy in the field without this fear that they're potentially going to be hurt or somehow their safety is going to be jeopardized. So that's a little bit of a rough overview of kind of what we're seeing in the community. So hopefully that explains a little bit.
It does, thank you. I was thinking it would be good for each of you to also talk about the resources that you have and needed. I heard you specifically, Karen, say, fewer resources than you really required. So if you could just talk about that for each of you, thank you.
Fewer resources. I think really it's just increasing this capacity locally to be able to help people across the continuum of mental health treatment. And I think Karen is going to probably echo a little bit of that as well. We see this going all the way to our jail system, where we bring in, people get taken into custody for a variety of reasons. Santa Cruz, it seems like in our experience is, it's a small town with somewhat big town problems when it comes to folks in crisis and that system. And so it's looking at, increasing the capacity for bed space, both for residential treatment and mental health treatment, all those things. And there's a little bit of this not my backyard aspect to not wanting to increase some of the capacity, in terms of, SLEs and treatment facilities in various aspects of the county. The siting is tough because of some of those reasons, but it's definitely needed. I mean, the lack of really justice involved beds for folks leaving custody, such a huge important piece that somehow that could be increased, because folks leaving custody, they're the cleanest they've ever been, because it's largely an intersection from what we see of substance use disorder and mental health. And so it's, when they leave custody, they are as likely, we're providing mental health treatment in custody, we're providing substance use disorder treatment in custody, but once they get released, where do they go? And so unfortunately, sometimes that's back into these lifestyles that do not produce a successful outcomes. And so increasing that capacity, I think, for the folks that are justice involved and that are high risk, I think is extremely important.
I think you read my notes. Yeah, so just to piggyback on what Chris was saying, and I also wanted to say that we have mental health liaisons embedded in the County Sheriff's Department, but we also have them embedded with Santa Cruz Police as well as Watsonville Police. And the work they do is, it's amazing. It's unbelievable, honestly. Like when you say miracles, it's truly miraculous. And we're really grateful to be able to have those partnerships with law enforcement, because I think it's been able to shift the trajectory of people's lives to get them, off that ledge and into services, and then, hopefully onto a recovery path. So yeah, I think that Chris mentioned co-occurring services that we do see, probably more than half. It's a little hard to nail down data, but more than half for sure of our clients and then people out in the community, if they are experiencing a mental health issue, they're also experiencing some sort of a substance use disorder, or at least using substances in some way to either medicate their symptoms themselves and or cope with things, right? So I think in our county, it's really in the state, the way that the payment systems are structured between mental health and substance use disorders, even though there's a push and sort of like a movement to sort of integrate mental health and substance use under the behavioral health umbrella, the way that the payment structures are designed, it makes it very challenging to braid the funding so that you're able to serve individuals who are experiencing both of those co-occurring disorders. So that is something that we're looking at the county, is how can we leverage existing payment structures and braid them to be able to provide more co-occurring opportunities. And then also, like Chris said, the crisis is the front door to a system of care. And so it's the thing that people see the most because it's people at their lowest, right? So it's distressing, it's disturbing, for people, especially if they don't really understand what's going on. And certainly in our population of community members experiencing homelessness, it's, in some ways even more challenging because they don't have any of those basic needs met of, stable shelter, housing, food, resources, whatever. So it's a little bit more distressing for them. But once someone enters the crisis system, what we really need is a trajectory of services so that we can support a recovery-oriented pathway for them. So that the crisis service is really a brief intervention. It's the long-term services that we really could focus on to build out that system of care here. And the other thing I would say that we're experiencing here, and I think this isn't specific to Santa Cruz, but really nationally, we're seeing a workforce shortage, and we're seeing it in healthcare, we're seeing it in education, we're seeing it in law enforcement, whatever. It's just really challenging to hire for positions that we have. And so having those workforce challenges it holds us hostage a little bit to really be able to provide the breadth of services that we need to. And that's true at the county. It's true in our community service providers. So whereas we're trying to build out a system of care, we can't get the people to fill the positions to actually make it happen.
Before talking about services, I think I'd like to continue with kind of the theme of the challenges that we face to be able to address a lot of these challenges. And I think there's 4 challenges that we face in the education world that I'm sure are shared by the county and law enforcement as well. The first one is funding and getting enough funding for the services that we need. But not only that, you're hearing talk about the braiding of funding, meaning that if I a student that qualifies for Medi-Cal because their family's low income comes in, we're able to provide services to that person. But if they don't qualify for Medi-Cal, we have to try to find alternative funding because most health insurance will not cover the cost of that service. And traditionally what has happened is we basically told them, your parents need to go find you a therapist because clearly you don't qualify for Medi-Cal. So, here's a couple of numbers to call. And that's unacceptable in today's world when a young person is having a tough time. And that is going to change for us soon, and I'll explain that in a moment. The second challenge is something Karen already brought up, which is staffing, is being able to find enough therapists. We are kind of fighting over a very limited workforce of people who are licensed or experienced who can work. And it's not only once you get somebody who has this experience, you bring them in, they may not be qualified for the different levels of service, right? I may be somebody who could work with somebody who's experiencing anxiety, but the minute this goes into suicidal ideation, I may have to step back and say, you know what, I need to find somebody more experienced and qualified to be able to provide that support. It's not a one size fits all. And the third area would be stigma, which is that the concern from adults and youth and parents about mental health, about seeming weak or being ashamed of it, or it stops us from making the decision to get help for myself or to help my child get help, or youth who are afraid that they're, what people may think of them. That stops them from getting to letting people know what they're experiencing, what they're suffering, and getting help. And the fourth area are silos. And this is a systemic issue that where for a variety of different reasons, we're not able to send out referrals as easily and quickly as we'd like to. The limited, the school system is a silo in itself. There's nonprofit agencies that we work with, that we try to build good relationships with and provide a lot of the therapeutic support. There's county behavioral health. There's a lot of different silos in different organizations, and that can, especially when you're trying to create a fluid response system, an immediate service, you're navigating that and saying, well, you need to go to the M-line clinic to go get your services because you have high acuity needs. Well, there's a chance that young person may never make it to the M-line clinic. And so breaking through those silos is I would say, the fourth area that we're working on. Now, when it comes to funding, we have gotten in education a huge influx of funding the last couple of years during the pandemic. But we are anticipating that funding is going to be going away next year. It was short-term funding, the economy is turning, and we're being told that basically use whatever we got because you may not get any more. Right? So that's something of concern. If so many of the resources that we put in place we're going to have a sustainability issue. The other piece that is exciting and positive is that in 2024, schools will be able to bill insurance providers, and insurance providers will be required to reimburse us for mental health services. So January 1st, 2024, that's going to be a game changer because most kids will either qualify for Medi-Cal or have health insurance. And the health insurance companies will no longer be able to say, well, you have to come to our provider, or you will have to, we don't do mental health as part of they'll have to cover those costs. And that's going to allow us to be able to serve students, any student. You know, there's this new term we use of no wrong door. We want students to be able to come in and be able to get served wherever they're at. So those are the challenges we're facing. I don't know. I haven't talked a little bit about the services.
That's great. Actually, I'd like to go back to Karen for a minute. Would you talk a little bit more about the payment structure? Because I think a lot of us as lay people don't know all the details on that.
Yeah, sure. So in California, there's basically, if you are a Medi-Cal beneficiary, you have services are able to come for mental health through a mental health plan, and for substance use disorders through what they call drug Medi-Cal organized delivery system, DMC ODS. So we have two diverse ways to pay for services, and then we have within those payment regulations, you know, you have certain types of people that are able to provide those services and certain types of services that are billable, right? So, and each service has a amount that you can bill for, whatever. So it's just basically similar to insurance, but for a Medi-Cal population. But in the mental health plan, you're looking at, you know, therapists, psychiatrists, people who are trained in mental health. In the drug Medi-Cal organized delivery system, you're looking at people who are substance use providers, medical providers for medication assisted treatment, like Suboxone, which is also a critical intervention for folks experiencing substance use disorders. But there's two different disciplines, if you will. So there's not a lot of crossover in expertise. And so it makes it challenging. So if you have somebody has a mental health condition and needs services in mental health, and then they also have a co-occurring substance use disorder, you actually have to get services right now in two different systems of care that are, you know, we're trying to connect them, but again, it makes it very difficult because of the way the funding is sort of dispersed. And then you have your private payers that Ferris was talking about, and the services that are available under private insurance are much different and differently organized. And so, yeah, definitely, yes, we are competing with our therapist population, which is really challenging for us. But the services that you might get under private insurance, many of those don't really offer substance use disorder services. So it's very, it's just, we're not set up really in a way to fund the services the way that people need them. And people need services when they're ready, how they want them and need them, you know, how they're able to access them. I think you touched on are people who might be not just experiencing mental health or substance use, but also might identify, you know, on a gender spectrum, you know, that's not mainstream, or LGBTQ or BIPOC individuals. And so that extra layer of stigma is serious, you know, because it really does prevent people from accessing those services, even if they want them. And I think that we could do a better job also at the front door, reducing the barriers for those folks. And so that's another thing that we're trying to work on, county.
Karen, I have a quick follow-up. I thought I had heard once that we also are designated as a certain area, and that we're designated as a rural area, and that determines the reimbursement at the federal level. Is that correct?
Yes, that is correct. Santa Cruz is currently designated, sorry, that's the word, designated as rural.
And
Yeah.
what would change that? What would we have to do to change that designation to get a higher level of reimbursement?
You know, I don't know that it would actually result in a higher level of reimbursement. Yeah.
Okay.
Pull that out.
Great.
Thank you. We're going to go back to Chris. You know, each of you mentioned the challenges and capacity within the departments and agencies and shortages within the community. So I imagine that sometime recently involved on your strategic planning, and I'm wondering how you plan to address those. You know, is it training within your existing staff, or, you know, nobody has the magic bullet to get more staffing, but just what are your thoughts within your agencies?
Yeah, so right now we are kind of battling back a little bit to gain positions that are unfunded. Right now on the operations side of things with deputies, we're sitting we have 7 positions that are unfunded. Kind of the thing that's hurting us in corrections a little bit is really, it's just such tough work in our jails. And so we're dealing with a number of injuries. You know, we have a number of people out on injury, roughly almost 20% of our staff, just because about 100 correctional officers, about 18 are out on injury. In terms, so we're kind of working to gain those positions back. Training is huge for us. And so, post mandates 24 hours of training a year. We do basically 10 times that amount per year. We have a training day, 8-hour training day for each staff member once per month. We've done a number of different things to increase our capacity in dealing with people with crisis. One thing and one program, a couple programs I think that we're really proud of. One is it's a program we prescribed to about 5 years ago, put on by the Police Executive Research Forum. The program is called ICAT, or Integrating Communications Assessment and Tactics. And basically the entire thought behind this tactics program is interacting with people in crisis who are armed with anything less than a firearm. And you've seen these videos. And so nationally, where somebody's armed with a baseball bat, a knife, and they're in crisis. But what can we do to slow that down, bring different tactics to the table to really respect the sanctity of life, in the sense that, do we have to, does this have to end up in the shooting? And can we prevent the shooting from ever happening? And frankly, we've done that here. And so that's scenario-based training we do twice a year, where we're teaching deputies and training deputies to use time on their side. There's no sense in rushing these things. Engage our mental health liaisons. Provide space between you and the person in crisis. And then what other less lethal tools do we have that can give us, put us in a winnable position, both for us and the person in crisis, so it doesn't have to end up in a loss of life. And I think that's such a huge thing. And so this was something that we prescribed to about 5 years ago. And again, one we do twice a year with each one of our staff members. Great program. The other program I think that we're fairly proud of is our FIT team, our focused intervention team that works around the county. These folks, they address really an acute number of people in the community that are really, they're going in and out of our jails. They're causing quality of life issues downtown and throughout the county. And so really we identify 30 of those folks that really need help. And so this team of it was 2 deputies and a sergeant. It's 1 and a sergeant now. We're hoping to put another deputy back into that program. But really what they do is they're partnered with mental health clinicians from Karen's team. And so they go out and they have a list of 30 people and they check in with these people to make sure, because they're not always, as we found, and Karen I'm sure can talk about all the reasons why, but that they're not making it to appointments. They're not taking medication. They're not doing the things that they need to really take care of themselves. And so what this team does is they go out and with Karen's team, they find these folks in our community and then really do telehealth stuff. It's just kind of amazing. Administer medication in the field, really trying to get them on the right track. And then unfortunately, if they do end up in custody, that continuum of care continues into their time in custody, where they're continue to be treated so that when they're releasable, hopefully they're released to a program or some sort of treatment facility, so that all of that programming and treatment isn't lost. So just a couple of things that we're doing, I think that we're fairly proud of. And with COVID, our training slowed down, obviously, because of COVID concerns. But now that's so waning a little bit, we're definitely getting back into the swing of just increasing our capacity to being able to deal more effectively with people in crisis and provide better service. So that's just a few things that we're doing.
And I would say that just for us at County Behavioral Health, the last time I looked, which was I think September, we were down 30% of our positions, and that was across the board from direct service up to leadership. So it's just that has been challenging. Chris mentioned the FIT team, and I think what's effective about that team is that that sort of targeted caseload of people that are high utilizers of services, and they're high utilizers of jail services. They're also high utilizers of crisis services. And then there's also often a nexus with homelessness. And I think that what's great about the FIT team is, they are able to provide those interventions in the field. And I think that's something we learned also out of the pandemic, is we need to be able to go to people. We can't expect people to come to us, especially if they're in that sort of high utilizer bucket. I like to call them high utilizer group, because sort of a little bit softer term than high utilizers, but the reality is these are people who have very few resources and find it very difficult to stabilize in any of our programs or systems. And so getting that targeted attention is really key. And then the other side to that is our Healing the Streets team. So coming out of COVID, looking at data, we realized that we lost service to about between like 2019 and 2020, over 500 individuals that had been engaged in our system of care. So what was the common denominator? Homelessness. Of course, we went to telehealth, telephonic services, very difficult for people to access services. So we're doing similarly with the FIT team Chris was talking about. We have a team that of case managers and clinicians that go out with our homeless persons health project and do that street medicine outreach, but with a behavioral health lens, and are able to either provide a telehealth service to a doctor somewhere in the clinic and or provide medical services out in the field, including long-acting injectables, prescribing medications, and then the case manager can go help pick up that medication and bring it to that person. Daily contact, outreach, case management, how are things going? And all of that is great and it's improving. However, the main problem that we're having is that once they get engaged in the services, we're still not able to get them into a shelter or housing. And so that housing trajectory or housing sort of bucket of services, whether it's low barrier shelters up to permanent supportive housing, affordable housing, getting people, to improve their quality of life and get back on their feet. Most people actually are able to recover if they have the resources available to them to do so, and then give back to their community, find, joy in life, participate in their families, all those things. It's just a matter of getting them on that path and then having the right services on that path to keep them going. So that I would say is one of the most difficult gaps that we have is the housing continuum.
I really appreciated both Chris and Karen's kind of focus on kind of the social determinants of health, right? We can focus on one piece of that, but if you're not addressing all of these other pieces, then you may not be very effective, right? So like education is one piece, housing is another piece, economic security, all the different parts of those social determinants and that's why this is not a single institution or a single group of institutions. It is a society that has to come together to support people in the most comprehensive way. I do want to share with you a little bit about just how in education Power Valley Unified School District opened a community school center on Palm Street in Watsonville, which offers a wide variety of services, including food, including resources for mental health, including just a lot of different pieces. And I think that community schools model is something you're going to be seeing replicated, where schools will become hubs for a variety of different services. I'm going to draw a pyramid over here just because it might be easier to visualize how we organize our mental health services specifically. We use a concept that came from the medical world, which is multi-tiered systems of support. And imagine that all students are included in this pyramid. This is your kind of general population of students. The majority of students should be in here. Students who have some needs, some mental health needs, would be in this tier 2. And the students that have really more intensive needs would be in this top tier, tier 3. And so when we think about services, the idea is to try to create a culture where there's no stigma, where most people understand how to help, how to support, and identify anybody that needs to go into tier 2 to get some additional services, like a group working with a group of students with a therapist, for example, and then have a system to be able to refer them to tier 3 services, which would be one-on-one services. And then we kind of have this, what we call 3+, we refer to, which are students with really high acuity needs in stabilization support. They're really in crisis, maybe are suicidal and be more intensive. And so one of the things we're doing at this level here is that we've launched something we're calling the Community Resiliency Initiative. And we're going to be offering all high school students in the county a training called Teen Mental Health First Aid. And this is an evidence-based program that will really help students recognize the signs, be able to respond appropriately, connect students with services, all of those things that we would want peers, because usually peers are the first people to hear about the struggles of their peers. Also for adults, there's a training that goes with this called Youth Mental Health First Aid. And this one is really for adults working with students, and you have to offer both. And so we're going to be offering this to every single high school student and in the county, both in private and public schools. And then continue to increase kind of the offerings if we can find the staff and these kind of tier two and tier 3 level services. One of the approaches is to build wellness centers on school campuses. And so this is a model that has been very successful in other places. The idea is that there would be a dedicated place for wellness where a young person could walk in from their on their high school campus. There would be a whole system to be able to facilitate them getting there. And they would have a person on site. It's not a phone number. It's not sending you to another clinic. It's not we'll make an appointment for you next week at 3 o'clock. Come back. Somebody is on campus in place who's ready to serve you. And so we have a couple of designs ready to go. We're waiting for funding to be able to launch it. But our goal is to have this at every school in the county. And with the concern in what's happening to the fiscal, there's a fiscal cliff coming in education because the funding, as I shared earlier, is going to be a lot of the funding sources that we've been getting are going to be cut for next year. We're probably going to need the community to help us finish build these wellness centers. And they would be staffed by, we work with 4 different kinds of providers, school staff. We also work with federally qualified health centers, FQHCs. We also work with children behavioral health. And these folks are the youth side of that. And then we also work with third-party providers like Encompass Services, Water Valley Prevention Services. And so working with them, we're hoping that by 2024, that Medi-Cal students will be covered, students with insurance will be covered, that we would be able to create a system of care that would be on-site, on campus, that would provide all 3 levels of care. And we would be able to integrate on-site with these services. And that's what we've been working on for this training for team mental health first aid. We're going to be starting to offer the youth mental health first aid to adults January and February. And team mental health first aid, we're hoping to get it done in March and April across the county.
No, it's okay.
I only have 2 more questions,
Okay.
and then we're going to open it up to the audience here, and we have questions from our folks on Zoom. So my multiple question, let's start with you, Chris, is how can the public help you in your efforts? And the reason I want to start with you, Chris, is that there couldn't be a source of more misinformation and upset than things like Nextdoor, where people are upset but don't have information, and there's accusatory statements, and nobody's doing their job. And I wonder what are the other more positive things or the other channels that you all already use or plan to use, and that engage the public in helping you. Thank you.
So, I mean, social media, frankly, is a good thing and a bad thing, in a variety of different ways. We've seen disinformation from social media. We use it as a platform of putting out information to the public, but in terms of like some of the disinformation, crime is one of those things. It's a how you feel, sort of thing, where you don't know until it happens to you, but when it does, it seems like it's prolific. It's everywhere. When in reality, we've looked at statistics, crime data over the course of the last 50 years. And, some folks will talk about the good old days of the 70s and 80s, but unfortunately, that was a time when we had multiple serial killers running around our community and burglaries were way up. And so frankly, what I think, folks, it's hard to understand sometimes if you're the victim of crime, is that crime is really, really low. In fact, we're sitting at some of the lowest crime levels in the last 50 years right now. And so based on our population, based on our per capita rates of crime in a variety of different categories, from burglary to violent crime, it's all really, really low. And so the unfortunate thing is platforms like Nextdoor, things are happening everywhere. It's out of control. I'm glad I moved out of town. Frankly, I'm extremely fortunate, and I feel fortunate. I feel proud to live in this community. I'm a Santa Cruz resident. I have 3 boys. I raised my kids here. I feel good about having them, go out, ride their bikes, yeah, we have property crime, here and there, where if things are left out, it's a lot of times it's a crime of opportunity, but violent crime and frankly, even property crime is really low. So, and we've tried that before. We put out statistics and it's, but we get, it gets thrown back a little bit like, they don't believe it or we're cooking the books or something to that effect. When that's just not reality. We have a very safe community. And so, yeah, we've got some issues, with homelessness and some other things like that. And drug abuse, substance use, but by and large, it's a good community to live in. It's a great community to raise kids in. It's one I'm proud to call home. So it's unfortunate there are platforms like that push information out there like you see that turns into it's a gospel in a lot of ways. So that's a little bit of my feeling on that, Peggy. Hopefully that answered your question.
Yeah, I would say it's hard to counteract emotional with rational because it's such a feeling-based thing and people just, kind of take it and run with it in their heads. And again, the people who are, what you do see or what you do experience that is challenging, whether you're a victim of a crime or whether you're seeing, people at their worst out in the community and it's disturbing or it's uncomfortable, it elicits an emotional reaction. Which then you keep holding, right? And so it's just hard to keep fact checking. And like Chris said, we do the same thing. We put out statistics or share information or offer trainings, and it's just very difficult to counteract that. But that I think is what the public can do is take advantage of those opportunities to learn. Part of our suicide prevention plan is providing trainings to the community around things like you talked about youth mental health first aid. There's also psychological first aid or mental health first aid for anybody in the community, just to understand what can you do if you see somebody that's experiencing a mental health crisis out in the community, or, how can you work with your community or even with your family to support a family member that might be experiencing a mental health issue or crisis, ideally before it gets to crisis. NAMI, our local NAMI, offers wonderful education programs for the community around a variety of behavioral health, mostly mental health, but also behavioral health, youth, adults, whatever issues. And they're a great resource. Their website's a great resource. Andrea's agency, Family Services Agency, also is a great resource. So there are community education programs and I'm happy to provide Peggy with some links after this that maybe she can push out to members of where you can kind of get those resources. And then just be conscious of your own bias. Sometimes it's something that's very challenging for us. We all have them. And it leads to jumping to conclusions or generalizations. And I think it's just really important to recognize that we're all human beings and we're all struggling with something or another, but at the core of it, we're all human beings, right? And we deserve that respect and dignity that just as you would want that they would also need to have.
In addition, I would add, that we're expecting kind of a fiscal cliff with the downturn of the economy that is going to result in a lot of limited resources. And so I think advocating with our legislators to ensure that we protect what is most important to us. And if mental health is as important as I think you probably would agree it is, then prioritizing those funds to be able to at least continue what has already been funded, not increasing it. Also, I think helping us with that stigma, I think it's the idea that mental health or any challenges that we face are somebody's problem, that this is the school needs to fix it, or the city needs to do this, or the county is responsible for this. I think it's really having a sense of critical, that we have a kind of a community collective responsibility to be able to address these challenges, right? That we all have a role to play to support each other and to help our youth, that there is that our youth and of course our adults as well, that we all have to work together to provide these, and having forums like this, I think, is outstanding. That you highlighted this in our wanting to look at how we can support this. I also think that one of the areas that we're going to be going to the community for is doing some fundraising efforts, like for the completion of the wellness centers that we want to put in place, because there's no way that we will get enough funding from our grants and our funding sources to be able to do those. I think that the change in being able to charge insurance is going to allow us to hire the people to work in there, but the actual building of the structures and the spaces and making them as welcoming as we need them to be, I think is going to will require some additional help as well. And I think, you know, I just want to applaud you for talking about this, for asking about this. I'm just really grateful for the opportunity to be able to speak with you and all of the great work that you're doing.
Thank you. I have one last question. I'm going to move over here, and our lesson is we're going to have 2 microphones from now on. And I just want to say to Karen's point about resources, absolutely. You know, we can always put them on our website and push them out too. So my last question before we open up the audience is, given the challenges, the different ones and similar ones that you've all identified, how hopeful do each of you feel about meeting those challenges in the near future, in the near term? Chris.
Yeah, I'm extremely hopeful. And I think what you see is the collaboration between multiple departments up here right now. We have a very, while, we might work in certain silos, we work across those silos, we meet routinely. Government works well here, I believe, better than a lot of other counties. And I've seen this in other counties. So and I think it's the collaboration that we all have and trying to make sure that we're all communicating, we're all talking, we're all working together. We meet regularly between all 3 of us, because we know the link between, everything that we do, right? And so I'm extremely hopeful. And I think I love that about our county is that, you have government that's looking to work together to make things better for people that live here. And so, like I said, I couldn't be more proud of the way things work here and kind of our just unified approach to making things better.
Yeah, I'm also actually hopeful. And I agree that having even a forum like this allows us to sort of hear from each other in a different way than we might usually, and makes me sort of think about some things to reach out to Ferris for, reach out to Chris. Chris and I actually work together fairly frequently. Our paths cross, but yeah, I think that we've learned a lot from COVID to address some of those things like the silos. One of the core conditions for health and well-being is community connectedness. And so we have to be better together. So how we start, like whether we're braiding funding or leveraging different opportunities, or, how can we support, Ferris's goal of those wellness centers and bring in, support or figure out how to fund some of it through Medi-Cal maybe, or CalAIM, which I didn't talk about earlier, is also another opportunity. California is going through some Medi-Cal reform from past learnings of things that didn't work. And there's the No Wrong Door, which is actually an old thing that's new again. I guess everything comes around, but just, really focusing on, where somebody shows up, that's where we want to be. So instead of having them have to come to my building or the wellness center or get arrested or whatever it is, we want to make sure that we are there wherever people are, so that they can have that ready access. And then as we connect our services together and sort of try to beat down those silos, hopefully we'll be able to transition people easily without, having to go through things over and over again. And yeah.
I'll join that hopeful bandwagon. I feel very excited about the future, and I do feel I think that we're very lucky to live in this community. I think there is a commitment and a care about equity, a care about meeting the needs of families and young people who are struggling the most. That is very, very unique. And yeah, we have challenges. We brought those up, but I think that there is a kind of a commitment to addressing these that is unique, and I think that we're going to be able to address many of these challenges together.
Thanks. We do have questions on chat. The first round is if there are questions here in the audience. Does someone have it? What's it? I'm going to start here. I'll go there.
Thank you. For Chris, I was surprised at the large number of crisis calls you said you get. So I'd like to get a sense of what are these? Are most of these suicide threats or other things? Tell me what kind of things do people call in about?
Yeah, so the question was basically what are the variety of crisis calls we get? And frankly, they run the spectrum. I mean, for folks that are suicidal ideation, to folks that have mental health disorders that are, in crisis acting out, or causing issues for family members, youth that are in crisis, youth that are acting out at home, or, it's crisis lines and calls referred to us. So I think it runs really the gamut from, somebody like in the midst of attempting suicide, whether that be with a firearm, unfortunately, or, in just really, really desperate situations, with someone looking to jump off an overpass, or, things like that, all the way down to, a parent, going, my son or my daughter's out of control, they're destroying things in the house, and we really need help. And so they kind of run that whole area. So.
Thank you. I saw another hand over here, and then we'll go there.
This may be an elephant in the room, but I've not heard any discussion about healthcare, psychiatric services, and the paucity of beds available for such services. Can each of you talk about how your agency has dealt with healthcare and that phenomenon? Thanks.
You want to take this
Sure.
first?
I'll go first.
She's going to take this first.
I will.
Contract with healthcare. Okay.
Hi, yeah, so Telecare runs our behavioral health center, which comprised of our crisis stabilization unit, which is an outpatient under 24-hour entry point into the crisis system. And then the other half is our 16-bed psychiatric health facility, which is an inpatient psychiatric facility. And so that is really the crisis continuum of care is actually multifaceted. So that is one point of it, and other players in it are law enforcement partners, us at behavioral health, our hospital emergency rooms, emergency departments, or people come in through the healthcare system. So it's really a community, if you will, process or system of care versus just like one agency that's holding all that. Then you also mentioned residential care and substance use disorder beds, correct? I heard that. So we have currently in this county, let's see, maybe 75 or 80 substance use disorder service beds. Don't quote me on that. Of course, I'm on TV, but something around that. I don't have it off the top of my head. And then the same thing for mental health beds. It's about, let's see, 30, 34 or so. And that's not enough. And I think where we see our crisis system impacted is that we have not yet built out our, as I was saying before, our continuum of care. And so where we can focus resources towards increasing those lower level of care situations so that we can avoid the crisis, so that people in the community, as they're starting to escalate or starting to decompensate or unravel in some way, that we can get them maybe into a lower level residential bed, and then sort of get stabilized and well and continue with outpatient treatment. That's something that we're looking at behavioral health, is how do we adjust our resources to sort of build downstream, if you will.
So, one thing we're hopeful for, is obviously it's a capacity issue, right? And so, the county's looking at opening a 21 bed facility at the Watsonville Hospital through that program. And so we're really hopeful that goes into effect. The county's making strides to increase the capacity. In what we've seen is kind of through COVID and after COVID especially is definitely an increase in folks needing crisis stabilization. So that goes into those 20 some odd 5150 holds that we write per month, and it is a capacity problem because these folks do need some place to go, obviously, to help stabilize them. And so we have run into capacity issues at the Telecare site. And so, we have been taking them to Dominican Hospital, when Telecare has been on diversion. So they're getting, they're going to a hospital to get treatment. It does tie us up a little bit at Dominican, but, the county's making strides to increase that capacity. It's just these things take time.
Yeah.
And so it's working through that. But there are obviously some issues, at the line, in terms of getting folks where they need to be, and then ultimately to get our folks back in the field to be able to respond to calls for service.
Yeah, and just to add to that, I mean, again, that lower level of care continuum avoids people cycling through that crisis system, which is why I kind of brought that up. And we're also looking to increase our children's crisis services. And so we're looking for a site in the community to expand, to have actually right now at Telecare, our crisis stabilization program serves both youth and adults, which is challenging for a lot of reasons. And so how do we get children into their own facility with, they have much different needs, and we want to make sure we're involving families. It's kind of a space issue where we're at right now. So that's another thing that we're looking to cite right now.
Thank you.
I have maybe one thing is a suggestion and one thing is a question. Just talking about next door and thinking about, I bet a bunch of us in this room have complained individually and tried, like I personally tried to do myth busting as an institution, we tried to do that. What if we have like agencies, like going up to the government and agency level, saying to corporate next door, this platform is really messing with our community, our emotional health, our services, our political climate. That's just a thought that popped into my head. Like, as individuals, we're not getting anywhere, right? So my question for all three of you, and I hear this all over the place, is staffing and retention are like the number one issues all in every agency, it seems like. And part of the reason maybe limits on, like, say, the training that people have, but it also seems like the housing is a major issue. So the pay scale doesn't reflect the actual housing wage that employees need to be here and stay here. So would it be better to raise wages and have fewer employees? Like, maybe it has to be in as a COLA rather than an actual pay scale adjustment. But wouldn't it be better to have 5 mental health providers in our schools rather than 0? Even if the goal is to have 10. And just a question about staffing and pay and how it relates to housing. Because for my kids who are in high school, I would rather have a few more mental health providers in their school rather than no more. Or I'd rather have the care providers that are there and pay better so that they can stay because they're wonderful and we need them.
Thank you. Be interesting to hear you all address it because none of you can specifically do anything about housing, but thank you for bringing that up. And Chris, I'm going to start with Dr. Sabah. One of the things I often hear in the community is that people in your department are trained here, maybe work a little bit, and they go because the salaries are higher.
That's right.
Thank you.
The wanting to pay folks more is exactly why people end up bouncing around, is that we're competing against each other, right? So we keep adding to it. I do think there's things that we can do to address the housing issue. The measures K&L passed for Santa Cruz City schools are going to be building housing, residential housing for the school community. We're also the County Office of Education for the first time is now able to purchase land and build on it with this is a brand new thing that has happened without a match. And so we're going to be looking at building housing for the school community. I think that including people who are therapists in that for the school community is going to be really important. Because that's also really is going to be great for retention because people will want to stay in those homes. And so I totally agree that that we need to address kind of the housing issue. I think we also have to look at how we're creating a pipeline for more people to get into this field. And that starts with programs that can bring young people in from high school into community college, into universities, and get them in, kind of to create an education pipeline that will bring in therapeutic clinicians eventually to the system. And so that's something we're working on as well. We are competing. Unfortunately, you'll see this on our, we have a website called EdJoy where all the county posts there, and you'll see that the bonuses go up, and so we end up taking somebody, and sometimes they eventually go off to Santa Clara as well. So it looks to me like it's raising salaries and in itself doesn't solve the issue. Because everybody's doing it, we're still fighting over this limited resources. I think the number one thing that we can do is increase the number of people who are available and able to work. That's going to be the one way we're going to be able to address this.
Yeah, I agree with that. I also, in behavioral health, we contract with numerous providers out in the community, and we have across the board increased their contracts so that they can raise their salaries. So we have actually had some impact there. I think the housing is what it is here. So like Becky said, we don't have any control over that. I think that where we do have some control over housing is as low income housing for people who are experiencing, like in my world, behavioral health issues and also homelessness. And so we have a couple projects coming on to support that community to increase permanent supportive housing opportunities here. I do want to say that the workforce challenges, it's not just salary and not being able, like cost of living or affordability, it's multi-layered. I think that, coming out of the pandemic, like healthcare, education, law enforcement, all of us have been significantly impacted because we don't stop, right? We don't, how difficult it is. And I know this for my grandkids in first grade, trying to do school online, and I have teachers, really close friends who are, teaching young children online, and how much is lost in that, and having kids at home and the stress on the parents and trying to work from home and do school with your kids at the same time. And it's to me, an unprecedented time for us, and I think that we're experiencing a lot of, in our world, and I'm guessing and also your worlds, a lot of burnout from that. And I think that is what is impacting the workforce as well. People are I just can't give anymore. We're all in the service industry, and our orientation is to serve the public, whether they're coming in through whichever of our doors, right? That's what we do. And it's tireless work because people continue to need us, regardless of whatever else is going on in the world, and we show up for them. And so I think people just have experienced over the past couple of years, it's just, I can't anymore. I just can't do it. And have made decisions to change careers, or I think for us in behavioral health, the telehealth has allowed for many providers to work for private companies that do telehealth online for therapy and things like that. So they've made a sort of transition from in-person or crisis work or specialty service work to private therapy online, where they can work from home, and it's a lot less stressful. So I think one of the things we're looking at county behavioral health is, and we say like, oh, it's self-care, take a self-care day, whatever. We have to, I think, part of the solution, I think, for us is how do we take on the responsibility of that burnout, and how do we shift the way our systems are organized as an agency so that we're reducing stress on our workers? And how are we, pay is one part of it, but it's only one part of it. So what are some of those other things that we can do to make it a healthier environment for our folks to be able to work in our services?
Yeah, and just to echo a little bit about what Karen had mentioned, officer wellness is a real thing. We talk about that a lot. Law enforcement, like a lot of different government sectors, never went home during the pandemic. And then some of our issues only just became more compounded, and we saw that through a lot of things that happened through 2020, especially through our agency. I would say that we're getting better with pay. I know on a corrections side, we're coming closer and closer to not parity with agencies over the hill. We're never going to be able to compete with them. I have very little hope that we'd ever be able to get there. But hiring local folks, I think, has been hugely successful for us if we can find them. I think part of it, unfortunately, is just a little bit of a negative sentiment with entering into a career in law enforcement. And that's unfortunate. Law enforcement's an honorable profession. We do a great job here throughout the county with the progressive. Sheriff Hart has been great with progressive different initiatives that he's taking on and making sure that we're absolutely where we need to be. And I can say that about the other police chiefs too. We're very fortunate to live in a very progressive county. But housing is definitely a problem. It's an issue because, for folks young people to go into any job, whether it's law enforcement or anything, and then to find a place to rent, to be able to afford a place to rent, to be able to afford a place to buy, or just that dream of home ownership here is extremely tough. And so we all know that. And so, but however, if you're local, if you have a support system here that can help you, providing you a place to live for a period of time to save money, it's such a huge thing. So for us, it's really trying to attract local candidates for our jobs. Because frankly, we've seen this. If we hire somebody from outside the area, the chance that they're going to go back home is huge, or their likelihood to move over the hill but it's unfortunate because I think that the county has so much to offer and such a great place to live. So for us, it's just, I think, spreading the word that law enforcement's, it is an honorable career, and to live and work and protect this community is a huge thing. And what a better thing to give back. So I think it's just spreading that, amongst everybody locally, throughout the county, whether it's our agency or whatever agency folks live in.
Get my steps in here.
Thank you. I want to make sure that we get some questions answered over here and then be able to judge on the line. So I saw your hand first.
Thank you. I've got a question on youth and mental health and behavioral health services regarding the county's pilot project, emergency response team for youth. Two questions: what experience have you had with them? And second question is, what changes would you like to see as far as improving the program?
Yeah, thanks for that question. Yeah, our mobile emergency response team for youth, or MERDI, as we call it, is sort of a youth version of our mobile emergency response team for adult, which we've had in the community for quite some time. MERDI was funded through the California Healthcare Foundation CHAFA grant that we've had. South County, we focused in South County first. We have a really great van that is able to go out. It's outfitted like an office with Wi-Fi and everything. We got a little fridge in there with snacks. And so we can actually go to youth and not have it be like a law enforcement coming to the door type of situation, or be a little bit more private and, a little bit less stigmatized, and provide those services anywhere. We show up at schools, we show up at people's homes, we show up pretty much anywhere we get those referrals. Right now, we also wrote a grant to have it come to North County. Our van is done. We're starting to get the hiring started for that process. So we'll also have a team up in North County to be able to respond to folks up here. I think what's great about it is it's youth focused. So we're able to do a lot of things a lot differently than we are with adults. And I think that's why we, went for it in the first place. We need something to just focus on youth. I think one of the things we could do better at, and again, we started this program right smack dab in the beginning of the pandemic. So we're just now starting to kind of get out there a little bit more and get more visible. One of the things we're looking at is how do we sort of promote MERDI in the community by showing up at different events, having the van go to schools for different events, just getting the public educated about the service, and it's out there. How do you reach it? That type of thing. And then the final thing that we're trying to do is expand it to 7 days a week. Right now, it's a Monday through Friday program.
And I'll just add, just as a kind of as customers of MERDI and also the CERT team, is whenever an incident that is causing distress for youth takes place, we contact our friends in the county and they help deploy resources on site. When the incident at Santa Cruz City School, Santa Cruz High School took place recently, we helped working with the county and several other providers in Compass. We had people on site for 3 weeks, which also is very telling of how traumatic that experience was for youth and staff.
Thanks. I think we'll take two more questions. So you're going to go early and then we'll switch to our.
I think women's club put it together is great and all you folks for being here. But my question relates to a couple of different things. And actually, I have about 20 questions, but I'll try and boil them down to two. So you mentioned some program where there are folks who actually come out to people who need services that just can't take care of themselves. And I'm just curious, is that countywide or is that Santa Cruz City specific, or because I have a son who needs that and is getting it. He's homeless and just out there. And, he's about to lose his medical. And we can't figure out how to do the paperwork. I put myself in a position trying to help him, and unfortunately, it came to naught. My second question is, I heard all that stuff about lack of funding, how funding is going to go down, and yet I didn't read for quite some time that the state is going to actually be providing more money for mental health. So it kind of there's a disparity there. I'm wondering what's going on with that.
Yeah, so in terms of your first question, the Healing the Streets is the program that I was talking about. It is available right now in Santa Cruz City and Watsonville City. But we do have other outreach teams, and let's connect afterwards and I can help you figure out how to get connected. But that program does go out into those communities. It's a SAMHSA funded project right now. And so once that grant ends, we're looking to sustain it with other funding to be ongoing and eventually be countywide. So that'll come. The other question around, the state releasing funding streams, it's, each county gets an allotment of funds based on their size and how the state, depending on what the funding is for. Every funding stream comes with attached strings. So you have to, it's for this or it's for that. It's very specific often. It doesn't always target everything it needs to target to really provide that holistic service. So that's one of the problems that we have. And then otherwise, Santa Cruz is a relatively small county compared to other like Los Angeles, San Francisco, Orange County, San Bernardino, big San Diego. Those counties get a lot more funding than we do. And of course, they have bigger needs. Santa Clara is another one right to our north. So the way that they divide it up based on the population isn't always match the need in that county. So we're a small county, but for example, with homelessness, we have one of the highest rates of homelessness per capita in the nation, but we're not getting funded that way, right? So I think that's where some of the mismatch comes up.
And if I could add, I do think that there are some funding sources that are going to be continuing, but many of the sources, especially in education, including those for mental health, are based on a formula of how much tax revenue is collected. And so last year was a good year. This year is not looking like a good year. And so we're anticipating a significant amount of cuts. And I think that's going to be impacting a lot of different jurisdictions.
Yeah, good point.
Thank you. We'll do two more here. I saw your hand up.
I first want to thank you all for being here and for having such a educational and comprehensive perspective on the issue. I tend to think upstream. And I would like to propose maybe we support Santa Cruz County becoming a strong and full county. I've worked in this space for 40 years, and I would say that the round figures 30, 40, 50, 60% of mental health problems are based on violence or youth. And I think if Santa Cruz, it's got the karma, it's got the culture, and if we establish Santa Cruz as a trauma-informed county, we'd be all together. It's not a political issue, anti-violence. We would work together. There would be less burnout. There would be more outreach, and we would be more proud and deal with it in a good way.
I think I'll just, I also said I'm the board, I'm the chair of the board for Salud, and moving everything upstream and addressing the social determinants of health. I think violence is one of those pieces, but I also see as, from a societal point of view, addressing all of these complex issues like housing and having food insecurity and all these pieces, because I see this as kind of a collective piece. So I love the idea of being trauma informed. We do a lot of trauma informed training and for our staff, both our instructional staff as well as our therapeutic staff. And I also appreciate your idea of connecting to to supporting this idea of being to working towards having a society that's violent, free of violence. I also think that moving things upstream requires us to look at all of those conditions for those social determinants of health. And so I see this as well, I think as you are, as a big picture that requires more than these late interventions downstream. So thank you.
Yeah, I love that so much. Thank you so much for bringing that up. I think that, the concept of trauma-informed care, trauma-informed systems comes from really shifting your philosophical approach. And this is for any community member of the people that we're talking about here today that are coming to us in need, instead of thinking of them as like, what are you doing, or what are you thinking, or, what's wrong with you, to start sort of thinking more in terms of like, what might have happened to you, what might have happened to that person. And I think it just shifts in your mind, a different way of then approaching the situation. And again, sort of cutting through some of that biases that we were talking about earlier. At the county, we are in health services agency right now. We are going through a trauma-informed systems initiative. And so really looking at how is our system trauma-informed. So not only are we providing trauma-informed care, which has been around for a while, and like Kara said, we also do a lot of training in that, and just sort of assuming, part of it is just assuming that everybody that's coming into your space has experienced some sort of trauma. And by the way, trauma there's a lot of different, mental health disorders, substance use disorders, whatever, but trauma is the underpinning for most things that we see, and often starting in early childhood. So even the adults that are coming into our services often had an early childhood adverse experience of some kind. So when you talk about upstream, when I'm like in my adult services, and I just got a chance to participate in a children's focused prevention project earlier this week, but I was thinking, why am I here? I work with adults, but at the end I was like, oh, because when I'm designing our adult services, I have to keep those kids in mind, because if I'm helping those adults and intervening at a time, before things get too bad, then I might be able to prevent some child adverse experiences in the next generation, right? So I think just thinking larger systems wide, whenever we're in our spaces and designing or whatever it is, to just keep that sort of holistic frame in mind, and just understand that what we're doing now is supporting the wellness of our communities to come.
I would just add what you said is amazing. I mean, and that's something that we think about and we do talk about. I'll highlight a couple things. Our collaboration with the County Office of Education with the school safety partnership grant that we applied to address bullying on campus, cyber victimization, right? Cyberbullying. And then also some things that we're looking at with regards to preventing sex assaults, right? I mean, this is we've seen this, when you look at our stats, that youth are overrepresented, frankly, amongst the folks that are victimized when it comes to sex assault, largely due to consent and alcohol, right? And so really raising that awareness and developing programs of education and in our schools to bring that out there to, what does a healthy relationship look like? What does consent look like? All these things to help create, healthy relationships and really try to tamp down on the violence that we see and then the trauma that we see later downstream. So it's a great point.
Thank you. I'm gonna let Mike do the last question in person, and then we're gonna go to our questions. Yeah.
First of all, thanks for the presentations. I think, not just speaking for myself, but I think we have to be impressed with there's sort of theoretical grasp of where we're trying to be in the concepts that we're working on developing and the actual program being planned out and trying to respond. But I want at the risk of raining on that hopefulness parade. It may just be a little bit, I'd be happy to be corrected on this as well. But it's my understanding, get a metric on this, a sense of the scale of what's going on. That if a police officer or a sheriff arrests somebody with a mental health crisis, somebody with a mental health crisis, and they take them to the jail, or they start to move towards whatever, this person needs to be confined in some way or another, that more often than not, the answer is there's no place for them to go except jail. That there aren't facilities available, residential programs, matching that in the other areas, that if tomorrow morning, a homeless person in this town wakes up and decides, I've had enough of this, my drug problem and my mental health problem is not making me happy, I'm willing to deal with it, I'll go into a lodge program and get treatment, but they're told, well, that's great, and there'll only be a 1-year waiting list for you to actually get into such a program. And of course, in the following year, if I'm correcting that stat, most of it, they're willing today to go into the program, but sometime in the next year, what's happening in their lives on the street, such that they're no longer interested. So we have these great debates of the state about whether we should require people to be committed on mental health goals and so forth. But we don't have the resources that we actually grab them and force them into confinement. We wouldn't have anywhere but a jail to send them. So I'd like to know first if I'm right in my that it's just a rumor and it's not that bad, or is that the reality we're facing? And what kind of, maybe put some numbers, kind of dollars, a scale, what would it take in the way of resources to actually not have a waiting list for the year? But right now, tomorrow afternoon, we have a residential facility, the drug rehab or mental health services.
It's right.
Yeah. So I believe there's a lot of truth in what you're saying. In fact, we don't want these folks going to our jail. We recognize that's not the place that folks with mental health issues or substance use disorder issues should go to. Low-lying offenses, folks with co-occurring issues, they don't belong with us. And so we do absolutely believe there needs to be greater capacity when it comes to residential treatment, drug treatment, mental health treatment outside of corrections. It's not the right place, frankly. But that's ultimately, I think, what's happened in a lot of areas, is that, jail systems have become de facto mental health hospitals, in a lot of ways because of the surge in folks in crisis and really trying to catch up to where we need to be. So I think there is a lot of truth to what you say, but I would defer to Karen, I think, on specific numbers or the wait time.
Yeah, that's real. That is real. And I think in Santa Cruz, I heard Chief Freitas say the other day that he had, I don't know, a couple dozen people sitting in jail that were releasable to programs that have been waiting for programs. And I think that's the same thing, getting people out of our inpatient unit as well on the mental health side. It's hard to find placement for people to go. So, and this, we talked a little bit about this, like how do we build out that continuum of care so that we have enough places for people to go? And the other piece that I want to touch on that you said is the readiness piece, which is also true. And what we need is a diverse set of programs or services that are ready for that person, that when they're reaching their hand out, that other hand is there to grab it, that it's the right level of care for them, that it's a service that they want to have, it's a good match. It needs to be a diverse, everybody's not ready to, people want help, but maybe they're not ready to, stop using drugs altogether. Maybe they're ready to stop using heroin or meth, but they're not necessarily ready to stop smoking weed or drinking, right? And so where does that harm reduction model come in and that sort of acceptance of people's choice? We don't want to turn somebody away because they don't want to do it our way, basically. We want to make sure we have the diversity of options available for people to meet the need and choice of where they're at the time. We're going to get there. So I'm going to counteract again your sort of depression around it with some hope, because it's something that we're talking about and we're actively working on, and we're taking steps to work through some of those things. And I'll say, Calling, with our justice and law folks, one of the initiatives of Calling is to really work with those people to get their Medi-Cal started again once they're in jail. So benefits stop when you're incarcerated. And so often somebody is released and they're on the reentry side to sort of catch them, but it takes time to get their benefits started again. And so if they have medications, for example, who's going to pay for that prescription? Or if they are able to maybe get released into a sober living environment, who's going to pay for that first month's, rent for them until their benefits get going in. So I think there are some real opportunities at the state level that are coming down with some of the initiatives that we're looking at. I think it's going to take time to figure out how we use them most effectively, because there's a lot of them, and it's a little bit of a moving target right now in terms of trying to figure out which type of program or service or which type of transition plan or access plan is going to be the best one. But the hope is we have those opportunities and we're working through them.
Thank you.
We're pretty famous for closing the homeless month, so I see you looking. We're almost there. A lot of the questions that were asked on Zoom, thank you for all those questions. A lot of them have been asked here, so I'm going to combine the two that were asked, and then oops, I just lost it. Are there street teams working in Watsonville? And how are resources divided between North and South County? That's pretty general, but any response?
I think I would have to understand maybe what they're
What
meaning
kinds
by
of-
street teams. Is it mental health street teams? Is it law enforcement street teams?
I think it's the distinction between both laws, social workers or others.
Yeah.
That we have here.
Yes.
Yeah.
Yes.
Yeah, so that does happen. So there are teams that are working both North and South County, so.
And that really general question about how are resources divided between North and South County? Sorry. Yeah.
So if the question is how are resources divided between North and South County, our FIT team's working both North and South County, collaborating with our mental health liaisons. Mental health liaisons are spread, and Karen could probably touch on this. There are other agencies besides ours that have mental health liaisons and access to them as a resource 7 days a week. So I don't know, Karen, if you want to add.
Yeah, I'd say with on the law enforcement co-response side, we have mental health liaisons embedded both with Watsonville Police Department, Santa Cruz Police Department, and the Sheriff's Department right now. And we're hoping to expand that in the future to include Capitola and Scotts Valley. I think that we have our Healing the Streets team, which is our mental health homelessness outreach team. We focused the grant on the cities of Santa Cruz and the city of Watsonville because we wanted to have some equity North and South. And I'm still new here. I've been here about 2.5 years now, and I am aware of that sort of feeling of inequity in South County. And I think that resources, I don't know, I don't have the history of in the past, but I think that we are intentionally trying to ensure that there's equitable resources spread between North and South County.
Yeah, just to add to that, I think that very, very much in education and with the resources that we have, we're very cognizant kind of the equity issues and communities, zip codes, different parts of our community that don't have the same resources and need additional services. At the same time, I think that it's not as clear cut as saying South County and North County. In some schools, for example, in the Mar Valley Unified School District, because of the way the funding formula is equity based, they get a significant amount more funding per student than other school districts that don't have the same number of students from low-income families. And so in some cases, a school district like the Mar Valley Unified School District has a lot more funding to be able to provide more services than, let's say, Scotts Valley. And so you look at, let's say, a Scotts Valley Unified School District, they may get $11,000 per student, whereas for the year, whereas Mar Valley Unified School District may get something like $17,000 per student. And so in some cases, when we look at mental health issues across the county, and we look at the trends, they're not represented in certain areas. They're pretty consistent across the board when it comes to the things we talked about first, like depression and anxiety and suicidal ideation and eating disorders, all the challenges that we're looking at. So some of those mental health challenges are very well distributed across, and the needs are there. So making sure that we are providing adequate resources is something we try to do throughout the campus.
Well, thank you all very much, Chris, Karen, and Meredith. I feel like I've learned a lot, not just about the challenges, but some of the programs that are coming and things that every agency is doing and how your organizations work together. That was really helpful to hear. So how about a round of applause? Well, thank you all for coming on a Saturday morning. Thank you for being here. Thank you all for coming. Thank you, everybody in the room. And again, this is recorded and will be on our site, DWCSCC.org in a couple of days.
Very good.
And
Thank you.
anybody who wants to be an expert, going to here, thank you again.
Like family resources.
Oh, you're welcome. Yeah, you're very welcome. Yeah, sure.
Internet and nonprofit in Terminal Valley.
Yeah.
And it's constantly. Gonna develop those programs for police officers and firefighters and veterans. And so